Thank you. It's now my pleasure to introduce our commencement speaker. Our guest speaker today is such an impressive geriatrician that after you hear him, you'll think, I can't wait to get older so this guy could be my doctor. There's no way to overstate how important Dr. Ken Brummel-Smith has been in molding our College of Medicine. A key part of our mission statement refers to serving elder populations. So when the creators of this school needed to hire a founding chair for our Department of Geriatrics, one of only a handful in the country, they hired a past president of the American Geriatric Society and one of the most well-respected geriatricians in our country. He's stepping down as department chair, but thank goodness still remaining on our faculty. Dr. Brummel-Smith and his department have made sure that every one of our graduates learn how to care for older patients, because he says that kind of team-based, patient-centered care is what every patient of every age deserves. He's polite and patient and a kind and careful listener you want your doctor to be. Yet he also feels passionate about healthcare and isn't afraid to write the occasional letter to the editor about what he sees as wrong-headed suggestions for our country's healthcare system. Here's the first paragraph of a letter he wrote last year. I'm at my computerized health record getting ready to send an order for Zyprexa, an antipsychotic medication, to Newsday columnist Lant Filler. That's because his idea is crazy. Our students are crazy about him and chose him to be their speaker today. You're about to find out why. Please welcome Dr. Ken Brummel-Smith.
Vice President Kistner, Dean Fogarty, faculty, family, the Bridge to Medicine students, and the class of 2015. I am deeply honored to speak at your graduation. It's kind of weird speaking in this direction when I want to speak to you too, but in a way, in speaking to your family, I'm asking them to hold you accountable for the things that I say. I celebrate your success. I treasure the times that I've had to work with you, and I'm excited about the new life that you're beginning. It's interesting to me that 40 years ago, this month, I was sitting where you were, graduating from medical school. I had a lot more hair then. I also would like to take this time to recognize the person missing from this graduation, Dr. Charlotte McGuire. I miss her sitting in that chair, shaking hands with you as you go by, and taking great joy in all of your accomplishments. The College of Medicine and the world is a much better place because she lived. I miss her very much. So I'm going to start by asking you a question. Will you choose fear or will you choose love? About a month ago, I was giving a talk to the Capital Medical Society physicians about medical apps. You see, I really love this new technology. I love these medical apps on my iPhone or iPad where I can look up things that I don't remember, the right drug dose, a guideline, some information that I need to find is right there in my hands. I was very excited to talk to them about an app where you can look up the facts about the risk of heart disease and give the patient information about those facts and how it fits them personally. What I really love about this app is the patient can choose different treatments and see right in front of them on the screen how the risks change if they decide, say, to start exercising or eat a Mediterranean diet or take a statin. I use this calculator on my iPad with my patients almost every clinic session that I have. After my talk was done, one of the physicians in the audience came up and said, "So don't you worry that if the patient decides not to take the medicine, that something bad could happen and they might sue you?" I thought for a while because I hadn't even thought of that. Was I missing something? Had I not been thinking clearly? I thought about it some more and I thought, no, I have thought about this. I will not let fear drive my professional life. A wise teacher of mine once said there are really only two emotions, fear and love. Anger, hatred, prejudice are all manifestations of fear. But love is at the root of patient-centered care. It's putting the patient's needs first, even in front of your own. It's the willingness to sit down with a patient, put aside your own biases, in fact, your own fears, and seek with the patient the best choice for them. The American Geriatric Society will soon be releasing a new definition of person-centered care, and I was honored to be asked to participate in helping to craft it. It says, person-centered care means that individuals' values and preferences are elicited and, once expressed, guide all aspects of their health care, supporting their health care goals. That app, which, by the way, is called the Best CVD Risk Calculator, you should Google it and get it, is just a tool. It's just a way to elicit values and to talk about life goals. By hearing from the patient directly the ways that she chooses to live her life, I can be the true physician, a teacher. I can provide information if that's what she needs. I can see the kinds of choices that she wants to make and the fears that she has about them. I can hear those fears if my heart is open. I can try to find the motivation that's deep inside her that will lead her to change. I can better guide her on her path, not my path, her path. I saw a 96-year-old patient a while ago who came in with her daughter, as often people do in my practice. In the daughter's hands were a whole bunch of papers, which I recognized to be printouts of web pages. I asked, as I usually do at the start of the interview, what would you like to talk about? The mother kind of hesitated, looked at her daughter. I call it the positive head-turning sign. And she said, you tell him. The daughter kind of paused and said, well, I think mother has a deep venous thrombosis. I said, really? What makes you think that? She went on to describe the classic symptoms and signs of a blood clot in the leg, and that she'd researched it on the internet. I examined the mother, and lo and behold, I think she did have a deep venous thrombosis. Part of patient-centered care is asking permission before doing things to a patient. I now do this even before giving information. I ask, are you interested in learning about what your options are? They both said yes. I said, well, the usual course is we'll have you go into the hospital, do the definitive test to prove that there is a blood clot, and if it's positive, start you on blood thinners. I then asked, are you interested in learning some more about deep venous thrombosis? And they said yes. So I said, well, the blood clot in your leg, although it's a little painful, is not really the problem. The big problem is it might break loose and go up and stick in your lungs, and that can cause pain and shortness of breath and even death. They were both silent for a little while, and then the mother said, so is it a quick death? I said, aha, I need to be thinking about life goals, not the dose of hercumenin. The patient-centered approach is the real solution to the major challenge that we have facing us today in medicine, as Aaron mentioned, the high cost of healthcare. Indeed, including the patient's goals and values is the missing link in evidence-based care. If your patient truly understands the benefits and the harms of treatment, they'll make better choices. Recently, there's been many studies, many new books, and many articles and editorials about the use of unnecessary medical interventions. And the Choosing Wisely campaign is the shining example of this. But to have the strength to not do something that fear is pushing you to do, you have to engage in shared decision-making with your patients. And to do that, you have to have enough love to trust them. You will, and may already have heard from many physicians about all the things to fear in medicine. Patients suing you, the burden of paperwork and electronic health records, government or insurance intrusion into medical decision-making. Love is the antidote to those stresses. Love will overcome those fears. A love of patience is what feeds us and what keeps us invigorated in medicine, even after 40 years. A love of learning new things, new treatments, and new ideas about the limits of medicine is what keeps us engaged and active participants in this amazing profession. I love being a physician. Dr. McGuire loved being a physician, and she loved her little patients. There are many challenges ahead of you. Medicine is indeed changing. But there is one thing that will not, it must not change, and that is the power of a close patient-doctor relationship. No app will ever replace that. No guideline will ever take the place of that. I believe that your teachers and all of your very hard work have prepared you for life in medicine. They've prepared your brain. But my wish for each of you is to find your heart in medicine. I hope that you will remember with gratitude that every time you see a patient, what a gift it is that a stranger comes to you and tells you their deepest secrets, allows you to touch them in very sensitive ways, and puts their lives into your hands. They do that because we are physicians, and now you are too. Thank you very much.
Thank you, Dr. Brummelsmith. We share an anniversary. We also graduated 40 years ago from medical school, so I wish you hadn't reminded them of that. But I just want to thank you for everything that you've done for this College of Medicine. You've had a tremendous impact as a teacher and a mentor for a whole generation of students here at Florida State University College of Medicine. And I just want to reflect again on what we both talked about, and that was Charlotte McGuire. What we didn't say was that Dr. Brummelsmith was actually there with her when she died. He was not only her doctor, he was her friend, and she loved Dr. Brummelsmith. I mean, he really did. Thank you. On behalf of the class of 2015, the faculty and staff of the College of Medicine, I would like to present you some small token of our appreciation for you doing this for this class today. Thank you for your words, and thank you for your leadership. You can put that there if you want. So what do you say? Should we give out some diplomas today? The first step toward fulfilling our mission as a medical school is to provide for a diverse student body capable of producing physicians who understand and appreciate the call to provide for the medically underserved. The development of outreach programs to ensure such diversity is critical to that mission. Our outreach programs are producing outstanding results that will impact the delivery of health care throughout Florida and that are setting an example for medical schools across the entire country. Without question, they are producing outstanding medical students for the FSU College of Medicine. I would like to invite Florida State University Vice President for Faculty Development and Advancement and Associate Vice President for Academic Affairs, Dr. Janet Kistner, is with us today, along with Dr. Myra Hurt, Senior Associate Dean for Research and Graduate Programs, and Dr. Helen Livingston, Assistant Dean for Graduate, Undergraduate, Pre-College Programs, to join me at the podium. Dr. Kistner will confer the degree Master of Science in Biomedical Sciences, Bridge to Clinical Medicine. Dr. Hurt will present the candidates, and Dr. Livingston will bestow regalia.
Good morning, everyone. Great to be here and see such a lovely sight in both directions. The Bridge to Clinical Medicine major of the Master of Science in Biomedical Sciences is a rigorous one-year program which includes 3 semesters of coursework, biomedical science coursework in particular, research, and a community-based preceptorship. The program of study is designed to enhance the skills for the study of medicine and to reinforce the mission of the College of Medicine to train physicians in community-based settings working with medically underserved populations. These students have completed all the requirements for the degree. Will the Master of Science candidates please rise? Dr. Kistner, I have the honor, on behalf of the faculty of Florida State University College of Medicine, to present the candidates for the Master of Science in Biomedical Sciences, Bridge to Clinical Medicine.
By virtue of the authority vested in me by the Florida Board of Governors and the Florida State University Board of Trustees, I hereby confer upon each of you the degree of Master of Science in Biomedical Sciences, Bridge to Clinical Medicine. We extend to you our heartiest congratulations.
Students, would you please approach the stage and come toward me as I call your name? Once you've received your degree, please return to your seats and remain standing until all of your classmates have returned. It's going to take them a couple of minutes, some of those high heels, you know. While I have the opportunity, I want to add my congratulations to all of you, parents, friends, loved ones, the graduates, friends, and families here today to celebrate the culmination of such hard work. I know that each of you have played a role in their successful journey to this day. Congratulations to you. They'll be here soon. Nadia Sarah Akiach. Jared Shelby Barber. Carissa Michelle Brown. Shelby Hope Brown. Olenka Cafo. Zadina Imani Fisher. Bruno Henry Gay. Elizabeth Chinke Ichite. Brianna Danielle Jameson. Oluremi Omatayo. Stephanie Roland Rodriguez. Martín Sainviles. Eric Cornelius Walker. Did everybody hear his name? I don't think so. Eric Cornelius Walker. I want to congratulate the Bridge class on their accomplishment and their steps toward their ultimate journey, and welcome them to the class, the MD class of 2015. You may be seated. You may be seated.
I think it's a moment some of you have been waiting for. At this time, I'd invite Dr. Chris Leadham and Alma Littles to join us at the podium. Dr. Littles will present the candidates for Doctor of Medicine. Dr. Kistner will confer the Doctor of Medicine degree.
I'd also like to take this opportunity to congratulate the class of 2015 on accomplishing and successfully meeting all of your academic accomplishments and becoming physicians. Will the candidates for the Doctor of Medicine degree please rise? Thank you. Dr. Kistner, I have the honor on behalf of the faculty of the Florida State University College of Medicine to present the candidates for the Doctor of Medicine degree.
By virtue of the authority vested in me by the Florida Board of Governors and the Florida State University Board of Trustees, I hereby confer upon each of you the degree of Doctor of Medicine. We extend you our heartiest congratulations. You may be seated.
Bestowing the academic regalia will be our regional campus deans. Will Dr. Lucky Dunn of the Daytona Beach Regional Campus please come forward for the hooding of doctors from your campus? It is tradition that faculty members and alumni who are immediate family of a graduate, at the request of the graduate, are allowed to participate in the hooding of the graduate. So as Dean Fogarty stated earlier, we are joined today by 4 parents, 2 sisters, and 1 uncle. Dr. Rick Gonzalez-Rothi and Dr. Michael Sweeney have been chosen by the students to serve as faculty marshals in the bestowing of the regalia. Will the doctors from the Daytona Beach Regional Campus please come forward as I call your name? Dr. Amanda Therese Obrera. Dr. Sean William Adams. Dr. Georgia Christakis, being hooded by her father, Dr. Paul Christakis. Dr. Francesca Nicole Cirillo. Dr. Tyler Andrew Cobb. Dr. David Felix Duray. Sorry, Dr. Duray. Dr. Nicole Helen Dillow. Dr. Sarah Gayori. Dr. Brian James Gordon. Dr. John Daniel Hales III. Dr. Brian Hassani. Dr. Kyle Ikitani. Dr. Sudeep Kuchibatala. Dr. Brandon Andreas Lambiris. Dr. Stephen Arthur Lambro. Dr. Laura Michelle McLaughlin. Dr. Tiana Ildiko Montessori. Dr. Matthew Robert Neth. Dr. Kristen Gail Valencia. Dr. Catherine Ann Wright.
Will Dr. Randy Bertolette of the Fort Pierce Regional Campus please come forward for the hooding of the doctors from your campus? Doctors from the Fort Pierce campus, please come forward when I call your name. Dr. Ryan Joseph Berger. Dr. Sheldon Brown. Dr. Maureen Paula Bruns. Dr. Fernando Jose Guarderas Espinosa. Dr. Aaron Hayson.